My name's Sophia. I'll be your student nurse today. I'm going to be doing a postpartum assessment on you and just making sure everything's looking normal. Just performing hand hygiene, all that good stuff. I've got my uniform on and my name badge, all good there. Alrighty, I'm gonna go ahead and get started. I would do vitals first. Vitals on a postpartum mom should be pretty normal and close to regular adult vital signs. So I would do temperature, blood pressure, heart rate, respirations, make sure all of that is looking normal. Ask her for her name of date of birth as I come in and check her ID band to make sure everything matches. And then I would go ahead and listen and make sure everything sounds good. So I would listen to heart rate and respirations, all four quadrants of the bowel to make sure they are active, sounding good, which they are active. And so then I would move on after vital signs to the postpartum assessment. So I would first talk to her. Hi Anne, just wanted to see how you are doing postpartum with your breasts first. So are you feeling, ask her if she's feeling any, are you having any pain or like tenderness in any parts of your breasts? She'd respond no, or maybe some pain, but little to no pain in her breasts. I would ask her if she's got any warm spots going on. If she is breastfeeding, which she is breastfeeding, and then I would ask her if, any warm spots, any tenderness, and if she's having any lumps or any hard spots in her breasts. She would tell me that she is not having any of those things, and then I would go ahead and palpate the breasts, make sure there's not any of those hard spots, warm spots, or any pain there, and then for some education, if you are having any pain or feeling like you're having any engorgement while breastfeeding or while with your breast, you can put some cold cabbage leaves on, and that can help to alleviate some of that pain and inflammation if you're having any of that while you're breastfeeding. Another point of education would be making sure that if you are breastfeeding, you still can get pregnant. So after your 4 to 6 weeks of waiting to resume having sex with your partner, make sure that you are using contraception and going back to your normal contraception routine, just to make sure that you don't get pregnant if you don't want to be pregnant again quickly after giving birth with this child. So those are 2 points of education that you could use with breasts. So then I would go ahead and move on down to her uterus. So I would do a fundal check just to make sure that's feeling normal. I would note if it is boggy, which it is not, it is firm. I would also check to see where it is in regards to the umbilicus. So I would mark that it is 1 finger breadth below the umbilicus, which is normal for 1 day postpartum. It is firm, it is midline. And then for education, I would let her know that, so Anne, if it is feeling boggy at all, you would want to make sure you are massaging that fundus. It can be a little uncomfortable because you are wanting your uterus to cramp so that it'll cramp down and stop any hemorrhaging or any bleeding from happening. So if any of that's going on, any bogginess, you definitely want to make sure you're massaging that for 1 minute every hour. Just to reduce the risk of hemorrhaging and to make sure that your uterus is still cramping down, to stop that. And then I would want to note that it's midline. If it was up and to the right, that could mean that she's got a full bladder. So definitely want to make sure that it's midline, 1 finger breadth or at the umbilicus, and that it is firm. And everything is looking normal with Anne here. If she did have a cesarean, I would take a look at that incision now as well, and just make sure that there is no rita with the incision, no redness, edema, any signs of infection. Hers does have a dressing over it, so I would note that it is dry and intact. and that everything is looking good. She's not having any pain with the incision, anything like that. I would want to, with the cesarean, also make sure she has a patent IV, if it is running fluids or not, making sure that there's no redness and no phlebitis, any infiltration of the IV, which all of her IV does look good and healthy. She does not have a Foley in. Her Foley has been removed, but if someone still had a Foley in, you would want to check and see when that should be removed, or you would do catheter care and possibly remove the Foley as well. So all of that is looking good. I would go ahead and move to her bowel. So all 4 quadrants were active. I would ask her, and when was the last time you had a bowel movement? Have you had one after giving birth? And she has, which is great. Point for education, definitely want to make sure that you're increasing your fiber and your fluids for right now, to really prevent any constipation from occurring. You don't want to get any extra pressure on your bottom because of the possibility of hemorrhoids. If you have any hemorrhoids now, that would be very uncomfortable, so we definitely want to make sure none of that's going on. So we would want to definitely increase fiber and increase fluids. So then I would go ahead and turn her over and check her perineum, check for any hemorrhoids, anything like that. And have you had an epidural? And she has, because she gave birth naturally, so I would make sure to check that epidural site for no Rita as well. Any redness, swelling, make sure that looks good. The epidural is out and looks good. There's a dressing over top, so looking good there. She did not have an episiotomy, but she did have a little bit of tearing, so definitely point for education, making sure that that is clean. And so after every time you go to the bathroom, take that little squirt bottle that they gave you and clean really well. Make sure none of that's getting infected. So all of that looks good. No hemorrhoids on her. Then want to move down to bladder. So have you been going to the bathroom recently? She's been walking, told me that she went an hour ago, which is great. Point for education, definitely make sure you're going every couple hours because you don't want to move or displace that uterus at all. You want to keep that firm midline center. So and going to the bathroom and not having that overly full bladder will help to keep it that way. And making sure you're going to the bathroom often. Definitely, are you experiencing any burning sensation or any pain when you're urinating? She has told me that she is not, which is great because UTIs are very common after birth and postpartum. And so definitely make sure you're increasing all those fluids to avoid any UTIs as well, and keeping a close eye on that because you don't want to get any infection that can run rampant. So definitely keep an eye on any of those UTI symptoms. And then while I have her here, I would also check her pad. And how long have you had your pad on? And she's told me 15 minutes, so I would check her pad. And I'm seeing some red, and I would have gloves on, don gloves for this, just to make sure staying clean. And I would check, she does have some red drainage, some red rubra lochia on her pad, but it's only about the size of a 50-cent coin. And it's been on for about 15 minutes, so she's doing okay. If she was fully saturating her pad in about 15 minutes, I would definitely be a little nervous about hemorrhage. So make sure you're keeping an eye on your pad, and that it's not overly saturated in a short amount of time, but hers is looking good. So definitely expect that lochia rubra, that red bloody discharge for the first few days postpartum. And then it will move to serosa and then alba. And then, so after that, we would move down to her legs for DVTs. So I would be looking at her legs, making sure there is no unilateral swelling, which there's not. There's a little bit of general edema, only about 1+ in both legs, which is very common postpartum. Making sure that there's none of that unilateral swelling. And are you having any pain? in your calves at all? In either one, no. Any red, I'm not noting any redness in the calves at all. Any warm, nothing is warm, no warm spots, anything like that. Another point for education would definitely be to make sure you're getting up and ambulating, and that way you can reduce your risks for any DVTs postpartum when you're going to be spending some time in bed. So definitely making sure to get up and ambulating to avoid those DVTs. And then Anne seems quite happy. This is her first baby, and no flat affect, not noticing any postpartum depression. Make sure you're doing things that you love still, and that you're maybe getting out and getting some sunlight, all those good things, and keep your attitude up and positive. You have a brand new baby. Some other great points for education would be, make sure you're doing a lot of skin to skin with your baby. You breastfeeding is really great for reducing any hemorrhage because of that oxytocin that gets released. So that's helping as well. So just making sure you're getting up and ambulating, lots of fluids, lots of fiber, using those cabbage leaves and a lot of those non-pharmacological things to help with pain relief so that you don't have to take as many pain meds, things like that. Making sure you're keeping that perineum nice and clean to reduce any infection, keeping those UTIs, keeping an eye on that, making sure you're not having any burning sensation. So yeah, Anne, you're looking great. Congratulations, and